Well, it's in its final months in the power of the Howard government introduced a Medicare dental rebate for the disadvantaged and the chronically ill. But recent audits by Medicare have revealed the scheme is plagued by rorting and cost blowouts.
Now the federal government is looking to axe the scheme, and Medicare is asking some dentists to pay the subsidised money back. Dr Shane Fry is the president of the Australian Dental Association. He joins us now from Sydney. Dr Shane Fry, good morning. Thanks for joining us.
Good morning, Virginia.
So this particular aspect of the Medicare scheme, it cost something like $800 million last year. That's your understanding too?
Yes, I believe so. The chronic disease dental scheme was introduced some years ago. The ADA has always had concerns regarding the scheme and advised the government accordingly, because it's a non-targeted scheme, and the ADA believes that a public dental scheme should be targeted to the disadvantaged in the community.
I want to just get to your definition of a non-targeted scheme in just a moment, but what's been identified so far is that about $28.2 million has been claimed incorrectly under that Medicare program, which isn't a whole lot. I mean, that's not a massive amount out of that money that the scheme has been drawn down from.
Yes, I believe there are claims by Medicare along those lines. The issue is, though, that this is a non-compliance from an administrative perspective. The majority of dentists have been trying to utilise the scheme appropriately and correctly, and provide good treatment to those patients that would not necessarily otherwise be able to get such treatment.
So when you say it's a non-targeted scheme, even though it's a disease for those with chronic dental disease conditions and those who are defined as disadvantaged in our community, is that not targeted enough? No, because the scheme is open to a multimillionaire and a person who is not of good financial means, and these sort of schemes should be targeted to those that don't have the wherewithal to be able to access appropriate dental care on their own. Okay, so because it's both chronic diseases and someone who's disadvantaged, both those groups then could actually take advantage of the scheme. That's your fundamental criticism?
That's correct. The criteria for the scheme from a chronic disease, that's perfectly appropriate.
Yep.
The fact is that it's not targeted to the disadvantaged people.
Well, if the government then decided just to axe the scheme, then we'd be back to that situation that, well, frankly, we're still really in when it comes to dealing with chronic dental diseases in this country, and of course, the backlog of people who can't get access really to any dental services. Axing the scheme isn't going to solve the problem, is it?
That's correct. And the ADA has advised the government that it's underestimated the pent-up demand for dental treatment in the community.
Yep.
And the ADA's position is, before this scheme is axed, because it is in place, and I believe the date that is proposed this time is the 31st of December, another appropriate scheme should be put in place to provide dental treatment to those members of the community that are disadvantaged. Or
perhaps this scheme should just be tightened up and just refined slightly more. Would that do it?
I think there's lots of options, and the government at the moment has just established a National Dental Advisory Council to consider a whole lot of options to come forward to the community with regard to public dentistry.
Leaving rorting to one side for just a moment, and I mean, look, it can't just be my assertion, I guess, that percentage, that figure out of the $800 million doesn't seem like a whole amount, but just putting that to one side for one moment, I mean, because you're always going to have those who try and take advantage of the system. Whenever I hear claims that there's been cost blowouts in an element of a Medicare rebate scheme, it often seems to me that surely has to indicate that to some extent the scheme is a success and there actually is a huge demand for that medical service out there. Is that a reasonable conclusion to draw?
Yeah, well, that's what I indicated earlier. The ADA advised the government that we believe they'd underestimated the pent-up demand, and when this scheme was introduced, it wasn't accepted or well known about initially, but the public certainly know about it now, and the medical practitioners are referring patients to the dentist to receive appropriate dental treatment.
Well, I guess there's also an issue here, though, for your members too, for dentists to actually smarten up and fly right and not go claiming on behalf of patients who clearly aren't the ones who are meant to be targeted by this system and who could afford to pay for their own dental care.
But the issue here is that it's the medical practitioner that determines the eligibility. Once the medical practitioner has decided, the doctor has decided that the patient is appropriate and is eligible under the scheme, the dentist is obliged to provide the dental treatment that is required.
All right, well, clearly there seems to be some tightening up then of the definition of the scheme. Good to talk to you today. Thanks so much.
Okay, thank you.
Thank you.